Pulmonary hypertension for medical students. Pulmonary hypertension happens when the pressure in the blood vessels leading from the heart to the lungs is too high. With pulmonary hypertension, the blood vessels of the lungs develop an increased amount of muscles in the wall of the blood vessels. The heart pumps the blood from the right ventricle to the lungs to get oxygen. Because the blood does not have to travel very far, the pressure in this side of the heart and in the artery taking the blood from the right ventricle to the lung is normally low, usually much lower than systolic or diastolic blood pressure. When the pressure in this artery gets too high, the arteries in the lungs can narrow and then the blood does not flow as well as it should, resulting in less oxygen in the blood. Now, during hypertension, the arteries in the lungs can narrow and then supply does not flow, and it will result in the less oxygen in the blood. Now, what causes the pulmonary hypertension? Some common underlying causes of pulmonary hypertension includes high blood pressure in the lungs artery due to some type of congenital heart disease. The second is connective tissue disorders. The third one is coronary artery disease. The fourth one is high blood pressure. The fifth one is liver disease like cirrhosis. The sixth one is blood clots through the lungs. And the last one is the chronic lung disease like emphysema. But here the genetics can also play a role. Pulmonary hypertension can happen in association with many other diseases such as lung disease and the heart disease. The heart failure is common in pulmonary hypertension. Now, what are the risk factors for pulmonary hypertension? Pulmonary hypertension happens at all ages, including children, and its incidence increases with age. Pulmonary hypertension is more common among women, non-Hispanic, black people, and people age 75 or older. Now, what are the signs and symptoms of pulmonary hypertension? The symptoms of pulmonary hypertension during the initial stage of the disease are common to many other medical conditions, like example, difficulty breathing, fatigue. This often results in a delayed diagnosis until more severe symptoms arises, and those are like dizziness, chest pain, ankle swelling, or feeling the heart race or bound, that is what we call it as palpitation. Now, how is the pulmonary hypertension treated? There is no cure for pulmonary hypertension. However, there are many different types of treatments, including inhaled medication given through the veins under the skin, medicine to reduce the swelling in the legs, which we give diuretics, oxygen therapy, and to prevent the pulmonary hypertension, there is not all pulmonary hypertension which can be prevented, but you can take steps to prevent it by making healthier lifestyle changes and managing high blood pressure, coronary artery disease, chronic liver disease, and the chronic lung disease from the tobacco use. So this is how you can prevent it. And then the pulmonary hypertension can be divided into 5 different groups. The group 1 includes pulmonary arterial hypertension. Group 2 includes pulmonary hypertension due to left-sided heart disease. Group 3 includes pulmonary hypertension due to lung disease or hypoxia. Group 4 includes pulmonary hypertension due to pulmonary artery obstructions like chronic thromboembolic pulmonary hypertension. Group 5 includes pulmonary hypertension with unknown or multiple causes. Now, if we talk about the group 1, which is pulmonary arterial hypertension, so it could be caused by many underlying causes. One of those is autoimmune diseases. The second is congenital heart disease. The third is blood clots in the lungs. Could be because of the connective heart disease. Okay, just sorry about that. The group 1 could be considered to have pulmonary arterial hypertension includes inheritable causes, drugs, and congestive tissue diseases. That's what you need to remember, these 3 things for the pulmonary arterial hypertension group 1. Thank you.